So let us continue with Nash Therapeutics study streak and the remedy that Dr. Nash mentions after the ones that we discussed yesterday, eupatoriums and capsicum, is Spongia tosta. Now, if there is one remedy which gives you an insight into how Dr. Nash practiced and how he repeated, what are the follow-up guidelines in acute cases, then Spongia has to be one of the remedies that will tell you how Dr. Nash prescribed medicines at what intervals and how frequently and what should be the tapering dose. This is very important because every homeopath needs to have a guideline of how to give a medicine, how to repeat, when to stop, when to give the next. And this is what Dr. Nash speaks in the remedy Spongia tosta. If you are there till the end, you will understand what is there in Spongia tosta, which Dr. Nash wants us to understand and ponder over and implement in our clinical practice. The first thing which we should know, which Dr. Nash tells us, is that the action of Spongia as a remedy starts from larynx, goes so this downward activity of the respiratory tract affection is how the nature of the disease also will be, and the patient's description will also be. So the patient would probably come and tell you that I had some issue in the throat first, and then in the chest I had some infection, or you can examine and find out that there is cough, and then all the modalities, and the case opens up entirely. So the action of Spongia is larynx, trachea, bronchioles, which is how also the disease will reflect to you in the clinical picture as an onset duration progress. There are remedies that will go in the reverse order. First, the cough has happened, then the coryza has happened. It would probably need sepia, Merxol, uh, and upward ascending sensation remedies. Whereas here in Spongia, you would need something that you will you will get something in the clinical cases and the patients which is going in the downward direction. First the larynx is affected, the voice is hoarse, then there is some difficulty in swallowing to some extent, not majorly in Spongia but it's majorly there in hepar. Then the upper respiratory tract is affected, and then the lower respiratory tract. So it will happen maybe in few hours to few days. The duration varies from patient to patient, but if you understand this way of progression of disease, then you will be excelling in prescribing Spongia as a remedy in all your clinical cases. Dr. Nash gives a comparison of one remedy with the other remedy in entire of his leaders in homeopathic therapeutics. And if you are new to this book, then you should definitely read one remedy and go back to the other remedy which Dr. Nash tells. For example, in Spongia, he talks about aconite. So aconite is not the first remedy which Dr. Nash begins with. He begins with Nux vomica. And aconite is mentioned somewhere in between after the first few series of remedies. This is because he wants to give us an insight into how he thinks and how he prescribes. And for Spongia, he compares Spongia with aconite and also with belladonna, with hepar, with phosphorus, and how and when we should give this remedy. The cough is dry and it is as if a saw is driven through a pine board. Now, for this, you need to go to a carpenter shop or else get yourself an audio on the carpenter sawing through a wooden plank. That is how you will auscultate a patient when you will check and find out about his respiratory complaints. The cause will remain the same, dry cold winds, but the aggravation would probably, and the nature of complaints would probably be something like a carpenter cutting through the wooden plank. And that is what Dr. Nash tells, that he lived in a climate which was of northern hemisphere, and he majorly encountered such patients with short coughs, and he used to give Spongia, Aconite as the first remedy, Spongia is the second remedy in the 30 or the 200 potency. Now, if it does not help, what should a homeopath do? So, different authors have different techniques. Some go to higher potency, some repeat frequently, some give complementary remedy. Dr. Nash tells us that he, you know, gives aconite as the first remedy. He waits for some time. He gives it maybe a few hours, 4 to 5 hours, 6 hours. He waits for some time, sees whether it helps or does not help. If it does not help, he sees if the patient is getting suffocated, there are paroxysms of cough, and the patient is having difficulty in breathing. Spongia is the next remedy. So, since he lives in the northern hemisphere, he got the confidence by moving from lower potencies to higher potencies. Same is the case with all the Indian homeopaths, especially beginners. We find it difficult to go into 1M, 10M, 50M, etc., etc. But maybe India needs that kind of potency, experimentation, and also going forward in autoimmune cases and all the deeper pathologies. Dr. Nash gave Spongia every 15 minutes, as often as every 15 minutes. This is what he claims in his book, Leaders in Homeopathic Therapeutics. And if the amelioration is there, the duration of the dosage is lengthened. So maybe it is 15 minutes for the beginning part, and as the case progresses, he would probably give 1 hourly, 2 hourly. The secret to a homeopath success in acute cases lies in managing the dosage after the first prescription is done. And if you are able to do that, then the trust and the confidence of the patient on homeopathy and you will be far more greater than anywhere else. What to do when Spongia doesn't work? Dr. Nash gives these guidelines also. He would go for Hepar sulf if it is aggravation in the midnight or in the early morning hours. And if the case relapses, phosphorus finishes the cure. So if Hepar sulf or Spongia or Aconite has not helped, phosphorus is his fourth backup. So there are four backups which he has in all cases of coughs. This is what we should learn from a homeopath of such a stature. He tells us that there is great hoarseness and there is soreness, burning, cough is worse by talking, singing, swallowing. And if there is sore throat, we spoke about patients having sore throat in the beginning, and then the lower respiratory tract infection. In those cases, he has given belladonna in it as well. So there is a comparison of spongia with aconite, with heparsol, with phosphorus, and belladonna. This is a very brief insight into what Dr. Nash does, how he practices, and if we take some clues from this and implement in all the acute cases, our life would be much easier. The only challenge which a homeopath has is to compare and differentiate 2, 3 remedies or more remedies. So good to see many new people joining. Dr. Pranita, Dr. Shivani, someone named as Priya Reddy, someone named as Dr. Garima, Monica. Last but not the least, Dr. Nash tells us that in chronic affections, especially tuberculous affections, Spongia leads the race with phosphorus, sanguinary, and sulfur. Now, I agree that tuberculosis as a pathology is very rare to see in the hands of homeopath, considering the way the chest physicians and the higher physicians have exploited. But if you get a chance, you will have to manage with multiple remedies and tuberculinum or bacillinum. We have a case, very nice case of tuberculous glands, cervical glands. We will be putting up it up on our website. which is www.homeosetu.com. You will find the link in the bio. Right now, we have posted renal calculi management cases, calcaneal spur cases, and how do you understand the mind symptoms with the constitutional cases, classical symptoms, physical symptoms, chief complaints, physical generals, etc. So those who wish to upgrade their knowledge, they can log on to the site, enroll for the course, make the payment, and get the access. Currently, it is lifetime. It may change as the newer courses roll out. So get the benefit those who wish to get. The case of tuberculous glands that we have, we will be putting up it up soon. So you can stay tuned, and meanwhile you can have enrich the knowledge using the cases that we have put up already. So many times in our clinics we will be having patients of heart diseases, and it's very difficult to tackle them considering how cardiologists have lay their web actually. So how will you manage? If it is a valvular trouble, you have to directly focus on the pathology and the remedies associated with the pathologies. Constitutional has to be given in the background, but pathological remedy or a specific remedy will work as a specific remedy every few days or every alternate day or every 3 days. This is how my clinical practice has emerged in the last few years. Spongia has helped Dr. Nash in lot of valvular troubles. So has Lacases helped him, and this is where he differentiates Lacases with Spongia, where Spongia is aggravated by head low position. And in chronic cough of organic heart disease. Now, many patients of heart disease will land in our clinic with chronic cough, whether it is due to the beta blockers that they are taking or it is from just the heart condition. You will have to differentiate. And if it is organic heart disease only, no other medication is going on, Spongia will help the patient. So also Spongia helps in goiter, but this is where Dr. Nash ends his, therapeutics on Spongia. This is just a very brief introduction he gives about Spongia in 1 or 2 pages about how he practices and quickly changes from one remedy to another. I think this is what a homeopath should be doing in acute cases, and it should give you the confidence to implement similar protocol in different diseases. That's all from me right now. Log on to our website to get the benefit of the already existing courses that we have. That's all, and thank you for joining. I think Dr. Ganesh is there and some other few people. Good to know.